Not one, but two tragic accidents in Senegal within days of each other now. The World Health Organization says 1.3 million people die every year globally in road accidents. What is causing this high number of deaths on the roads, Doctor?
Hello, and thanks for the question. This is indeed a tragic event that has happened in Senegal and that we see happening in many countries in the region. And there are obviously many reasons for this. The poor conditions of our roads, the inadequate regulations around the cars, their safety features, all of these really add up to increase the risk of dying from the roads in African cities and villages.
Well, I want to highlight and explore more about what you've just said. Now, Africa and developing countries generally have particularly higher rates of traffic accidents compared to developed economies. Highlight for us, if you will, why this is the case.
Yes, thanks. As I was saying, we have, in terms of infrastructure on the roads, we don't always, and it depends, of course, on the country, but we don't have all the security features that are recommended. When it comes to regulations of the cars that we use, many used cars would not pass any assessment of road safety, and yet they're on the roads of our countries. It could be also, the infrastructure on the roads include also things like lighting, poor lighting and roads that have risk, potholes. All of this, increases the risk. Their speed limitations are not respected. So there are really many factors that have to do with our roads, with our vehicles, with the policy landscape that are not enforced in our countries, that make the roads less safe than in other parts of the world. And if the fatality rate is so high, it's also because we don't have adequate first response, emergency care. And so an accident leads much more to death in Africa than perhaps in other regions.
You bring me to my next question, very important point that you've just made there. Let's expand that a little bit. The WHO says traffic injuries are a growing public health concern. Speak to us about the impact of road accidents on health and health care.
Yes, it's really very costly when it comes to healthcare costs. After an accident, the accident, of course, can be fatal, but it can also lead to serious injuries, which require hospitalization, which require rehabilitation care, and this can lead to long-term disability. And this long-term disability will impact our economies and the livelihoods of those who are involved in the accident, very importantly. So we know that when it comes to the GDP of countries, road crashes and the deaths and injuries resulting, not only the death, but the injuries, will really have a toll on families and society as a whole. In addition to being, of course, a social crisis, because these accidents, the crashes, affect very often, according to our data, a majority of young men who are between 15 and 49 years of age, who are in their most productive years. So imagine what that means for a family and also for society as a whole.
Very well said, Doctor. Doctor, stay with us. Senegal issued a decree announcing strict road safety measures after 40 people were killed in a bus crash 9 days ago. Let's listen to a clip of the country's Prime Minister, Amadou Ba.
The ministerial decrees concern the ban on the use of public passenger transport vehicles on inter-urban roads between 11 p.m. and 5 a.m., the limitation of the operating period to 10 years for passenger transport vehicles and 15 years for goods transport vehicles. The measures also concern the modernization and renewal of the fleet, the prohibition of the import of used tires or second-hand tires, the free technical inspection in Dakar for all vehicles transporting people and goods, and the suspension for a period of 3 months of the technical inspection of private vehicles, and the opening as soon as possible of technical inspection centers in the regions, the reinforcement of the rescue and medical assistance system for the care of victims of road accidents.
Dr. Sako, thank you very much for standing by. One more question, if you would indulge me. Of course, there were several other new rules announced by the Prime Minister in Senegal, and we've seen many such decrees in other countries here in Africa. Do they really work? And what really needs to be done to improve road safety on the continent, Doctor?
Yeah, indeed. I mean, they do work. These decrees, the policies, are what is recommended to improve the safety of the roads, the safety of the vehicles, drivers' behavior as well. All these, if enforced, will have an impact. And we know that interventions actually do work. We've seen countries outside the continent who have made great improvements in terms of road safety. And I believe that if adequately implemented, these decrees will make a difference. But it's one thing to have a decree. It's really another to put it into practice and to make sure that the policies are funded and it's put in place and it's enforced and followed up in time, not only when the accident happens and that there's a certain momentum around acting, that it really needs to be sustained throughout. And yes, we do believe at WHO and with other partnering organizations working on road safety that this is indeed possible. It's possible to turn the tide.